Hello everyone and welcome to another podcast from Fit to Sport. Today we have a very different kind of a discussion. Okay, we have our in-house colleagues with me, Yash and Almer, and what we're going to kind of discuss is more of what time frame that we look at when we treat the patients, and something related to patient management or patient care or athlete care, rather than discussing any particular injury or particular topic. So Yash and Almer, welcome.
Hello, sir.
So you know what basically what we plan to tell our viewers today is how important it is to kind of give some time to the patient when we start treating them. So what we follow is once the diagnosis and all is done, and we kind of tentatively have a plan in mind, then we go about it. So what do you think, Yash? Like, how do you look at once you start treating the patient? How much time do you think you should give to the patient or anybody for that matter?
It depends on their experience. Like if they're seeing a physio or a sports medicine doctor for the first time, then they are more likely to bring up all the problems they have altogether and not focus on one. So it depends on their pathology. If they want multiple problems to be treated all along, then we have to just either find one or focus on everything in general.
Yeah. So basically, what there are kind of things that we follow, like whatever is the prime or the the pathology that is bothering the patient more, we have to start treating that first instead of many patients or athletes, or rather either some recreational players who come to us, they could have multiple problems, but we obviously try and kind of treat them which bothers them most.
Right.
So what is like, how do you say kind of about this?
So looking into physiotherapy or strength and conditioning aspect, other than we are likely in India, we look into US, they have a time schedule, like the half an hour slot is given for a patient and they are on time. But in India, somewhere, we have walk-in appointments also. So to schedule them, so we are very punctual in what the patient is facing through, like say a back pain. What is the patient's main misery? Like even if he can't get up, so we'll try to solve that in a setting in much lesser time, and then we'll give him a home protocol which he will be doing. So
Correct.
we
That is, yeah, correct, and that is one part of looking at it. But what happens most of the times is we see a lot of people coming who have already been taking treatment somewhere else, and it happens. I mean, people, when if they're not like kind of feeling better, they do come down and take another opinion, sort of the same. Even we send a lot of our patients for second opinions when we know that if we are stuck somewhere, because nobody can be like 100% correct, in the sense you might miss out something clinically, or maybe something which, so it can happen to anybody, and we're very open about it. But we see a lot of patients who come to us who have taken treatment, and they are a little kind of not confused, but they're more concerned about their problems. So how has your experience been when you kind of treat some of these people who have been taking treatment, and then they're seeking some solace from this place? So how do you look at it?
It could vary also, means either they actually have a lot of complaints physically, or they might be just needing someone to talk to more about it and the problems they have socially and everything we have to look at. So
This is a very good point.
Right.
Sorry, I'm interrupting you, but we cannot just focus on the pathology alone. We have to figure out that considering the other factors that can contribute to the aggravation of that particular pathology is also important. And yeah, you remember that lady when just last week when we saw her, where she was not that she was not diagnosed properly before, but just with a session of MFR and just about counseling her, within a couple of sessions, she was so much better. So yeah, I think this is something that we need to understand, that whenever we treat any pathologies or any patients or clients or even athletes, understanding in toto is something that we need to look at when we start treating. Uh, any other experiences that you feel should be shared?
One thing which we do here unique is we go to the root cause of the problem. Like we don't only see the symptom, we see why is it hampering them. Like we don't stop the patient. Like if a runner comes to us, mainly we go to other people, they can stop it. But we tell them to reduce it. If it's not going to impact, we give them a solution in a various way, but to continue to a long problem. Elsewhere, what happens is when people want to do something and you stop them from doing, then it's either way. They back out or they just don't listen to us. But we giving them a solution, something different, treating their problem, they come to us more often. And happy
Correct,
mind.
yeah. So basically what, there are a lot of recreational players, usually they face some injuries and things like that because they are not professional players. And when they come to us, our first intention is to make them continue what they like, when either their sporting activity or their weekend activity or maybe their running activity, cycling activity, whatever they are into. It is very easy for a professional to just say, can you stop everything and just take this medication and you'll be fine, and then something of that sort. I mean, of course, we cannot generalize it, but it is more important to give them a confidence, and also, mostly everything depends on the injury. I mean, there are at times issues where we tell them to kind of halt the activities, especially when the stress reaction in the TPI is high. Remember, we saw that player where they had a player where the stress injury was a little too much. Then we have to, in that case, to prevent something which is avoid some stress fracture, we have to tell them to curtail or stop for some time. But there is a solution, and we can go about it. Anything else that you feel is important for people to know in terms of patient handling?
It all depends because you have to see it as a person having a problem. It's not just a patient. Means when you look at that way, then you only look at a specific problem of a diagnosis, is what you find. But as it is, what you do over here is find the cause of it and not stop doing the activity which actually increases the pain.
Yeah.
So that's what we here for actually. Instead of stopping the activity, just to modify it or reduce the activity.
Right. What are your thoughts about using modalities, like different modalities?
Somewhere I generally don't believe in modality, because when we have manual therapy with us, I don't generally suggest anyone to take modality. If at all it is required in the rare circumstances, yeah, we generally use them. But without modality, we as physios can do much more. Only exercise is prescribed.
But we do use in some cases.
We do use.
That is not necessarily, as I said, we don't use it altogether, but wherever required. And that too, whether it is more of very few modalities actually are evidence-based right now. It is going on, especially this routine one which are used rampantly in most of the places. It is more about, as he rightly pointed out, sorting out the problem rather than the root cause, rather than working on just the bit. This is one part, using modalities and all. What about getting these people or athletes back to do what they were doing before the injury, like the rehab part is over? And what is your thought like? You know that now rehab is over, the patient or the athlete or the client is pain-free now. And how do you look at advising them getting back to what they were doing before the injury?
Right. Rehab is itself is a phase-wise thing that you do. So if any point of time you feel like there is a gap between a rehab and return to play, that means itself your rehab is not complete, because you're focusing itself on making the person to go back to sport.
Right. So this is one part of it. Now, how do you look at the strength and conditioning aspect of it? How do you bridge the gap between a rehab phase, last phase of rehab, so to say, and then conditioning phase where?
So if you're talking about an athlete per se, we have a return to sports as the main thing. There are certain tests which can be done. So when athlete if he is having an injury. So even if he comes out of it, there are certain steps when we are going to progress with weights. Then you given a unilateral or bilateral working function. You just can't tell an athlete if he doesn't have a dorsiflexion. You can see if the dorsiflexion is restricted and he can't squat. He can't just go back to a normal lifting heavy squat. He will come back with an injury. So then we have to work on it in a stepwise manner. We have to improve the dorsiflexion or whatever our goals are, and then slowly we can just put them accordingly to the weight, step by step manner. But
so one point is obviously return to sport tests, but then do you think it is necessary to move on to the functional aspect of it in the later period of
As in functional tests rather than sports?
You mainly have a combination of functional testing and more of sport specific testing.
Right. It makes more sense because that is what the person is going to do rather than just move the arm into abduction or flexion and check the range. So instead, how much is the requirement and is that fulfilled? If it is fulfilled, yes, the person should be ready for sport.
Right. So basically, let me just kind of sum up the whole thing that we discussed. One is you have to give sufficient time to for the person to get treated, be it in one session or multiple sessions. That is one. Time given to that particular treatment depends on obviously the problem, the pathology, the injury the person comes up with. Second is there are phases of rehabilitation where from one phase you have to move on to the next phase. There are no shortcuts because then once there's a shortcut, that means you are likely to come back with re-injuries. Third is depending on what age group and whatever return to sport or recreational or a professional athlete, there are certain systems, evidence-based that we need to follow. And I guess this kind of for discussion will obviously give some idea to our viewers and even some physiotherapists who might be listening to us in the long run, where they will understand that just by having slots of half an hour is not going to help like what it is in the West, because they have a different system altogether. We have to have more of a connect with the athletes and patients. So yeah, thank you very much, Yash and Alvar. It was a lovely discussion. I hope we kind of take up some different topic, which is kind of generalized, just to give you an idea about how the working pattern should be. It will be more also understanding at some point of time when we have a whole team of Fit to Sport discussing about the working atmosphere and things like that. So not many things coming up your way. Keep watching all the podcasts. Thank you.